When we reach our 60s, the body begins communicating with us in new ways. Some messages are gentle, like a little stiffness in the morning. Others are soft warnings that something deeper is happening. Sleep problems fall into that second category. Many people think poor sleep is just an inconvenience or an unavoidable part of aging, but the truth is far more powerful. As someone who has spent over 3 decades caring for older adults, I can tell you that sleep holds some of the earliest clues about your brain and heart health. And when sleep starts to change, the changes are rarely random. Sleep is one of the most critical regulators of your entire cardiovascular system. At night, your body is supposed to enter a healing mode. Blood pressure drops, inflammation calms, blood vessels relax, and your heart finally gets a break from the constant work it performs all day long. But when sleep becomes fragmented or shallow, that restoration never fully happens. Instead of supporting the heart and brain, poor sleep pushes them into a state of silent stress. Let me help you picture this. Imagine your blood vessels as flexible, living pathways. During deep sleep, these vessels expand and contract in healthy rhythms, almost like they're breathing. This helps maintain vascular flexibility, which protects you from clot formation and blockage. But when sleep is disrupted, these vessels stiffen gradually over time. Stiff vessels are more vulnerable to damage, which creates the perfect environment for stroke risk to rise. Another crucial factor is blood pressure regulation. Normally, during restful sleep, blood pressure dips by 10 to 20%, a phenomenon called nocturnal dipping. This dip gives the heart and vessels time to rest and recover, but in people with sleep problems, this dip doesn't happen. Instead, blood pressure stays high or even spikes throughout the night. These nighttime elevations are one of the strongest predictors of morning strokes, especially for adults over 60. Many seniors who have normal readings in the clinic still experience dangerous nighttime hypertension without realizing it. Oxygen levels also play a major role. Every time your sleep is interrupted, especially from breathing problems, oxygen flow to the brain decreases for a few seconds. You may not notice it, but your brain does. These repeated drops force blood vessels to tighten suddenly. Over years, this oxygen roller coaster damages vessel walls, increases inflammation, and makes small clots more likely to form. If you've ever woken up gasping or with a racing heart, that's your body showing you how hard it's fighting for stability. The chemical balance of the body is also reshaped by sleep. When sleep is irregular, the body releases more cortisol, the primary stress hormone. Too much cortisol thickens the blood, raises heart rate, and weakens the protective lining of blood vessels. Elevated cortisol also encourages plaque buildup, which can block the arteries supplying the brain. Inside the brain itself, deep sleep is when toxins are cleared and neurological pathways repair. When this cleansing cycle is interrupted, inflammation increases. Inflammation is one of the hidden forces that accelerates stroke risk because it weakens vessel walls and makes them more prone to rupture or blockage. So when we talk about sleep problems, we aren't just talking about difficulty falling asleep or waking up tired. We're talking about a series of physiological processes that affect your blood pressure, oxygen flow, vascular health, and the overall stability of your heart. Each night of poor sleep becomes a tiny pressure on the body. One night means little, but months or years of disrupted sleep become a risk factor almost as powerful as diabetes or hypertension. The body whispers long before it cries, and sleep is often the very first whisper. In the next part, we'll explore the specific sleep problems that act as hidden stroke triggers and why so many seniors accidentally overlook them. Sleep problems that serve as hidden stroke triggers. As we move forward, I want you to think of sleep as a messenger. It's one of the most honest, reliable signals your body sends. When something begins to shift inside your cardiovascular system, sleep is often the first place those changes become visible. The tricky part is that these signals rarely appear dramatic. They're subtle, quiet, and easy to excuse. But each one carries meaning, and understanding them can protect your long-term health. Let's begin with one of the strongest and most underestimated triggers of stroke in older adults: sleep apnea. Over the years, I've heard so many seniors say, "I've always snored." They say it with confidence, almost pride. But snoring is not the heart of the problem. It's the breathing pauses, moments when air stops flowing into the lungs. Each pause causes a drop in oxygen, and the brain reacts with urgency. Blood vessels constrict, blood pressure spikes, the heart strains. Over time, these repeated stress responses damage the vessel lining and make clot formation more likely. The signs are often right there: loud snoring, gasping for breath, waking up with a dry mouth, or a dull headache in the morning. But because these moments happen while we sleep, many people never realize how often their body is struggling. Another hidden trigger is insomnia or fragmented sleep. Many older adults fall asleep easily, but wake up repeatedly through the night. They assume it's just part of aging or the result of stress. What they don't realize is that each awakening disrupts the body's blood pressure rhythm. Instead of enjoying the restorative dip that protects the heart and vessels, the body stays in partial alert mode. Deep sleep becomes shallow. Repair slows. Over time, this pattern contributes to hardened arteries, especially in adults over 60. I've had patients tell me they feel like their brain is tired but wired, unable to enter that peaceful, healing state. When sleep fragments, repair fragments too. Frequent nighttime urination, what many call just getting older, can also be a signal that the heart is under strain. When the heart has difficulty managing fluid efficiently, the body compensates by shifting excess fluid at night. This leads to more bathroom trips, which further interrupt deep sleep. And without deep sleep, nighttime blood pressure tends to rise. This cycle can go on for years without anyone realizing it's a cardiac issue rather than a bladder problem. Restless legs or nighttime tremors often surprise people when I mention their connection to stroke risk. These sensations reflect a nervous system under strain. The constant urge to move, the jerking, the buzzing energy in the legs. These symptoms disrupt sleep and increase vascular stress. Many seniors struggle with this for decades, unaware of how deeply it affects their heart and brain. Then there are the sudden awakenings with confusion. I want you to picture this. You wake up and for a brief moment, you don't know where you are or what time it is. You shake it off, thinking you were dreaming or simply exhausted. But sometimes that moment of confusion is a clue. A mini-stroke can resolve quickly, leaving behind nothing more than temporary disorientation. These episodes often go unreported because they disappear fast, but each one leaves a subtle imprint on the brain. Excessive daytime sleepiness is another major sign that restorative sleep isn't happening. When the brain fails to enter deep sleep, it compensates by demanding rest throughout the day. This overwhelming urge to nap isn't laziness, it's physiology. Studies show that excessive daytime sleepiness in adults over 65 is strongly correlated with silent strokes, the kind that quietly steal cognitive function long before symptoms become obvious. And finally, waking up with numbness or weakness should never be ignored. Even if it fades, it might be your body telling you that something significant happened overnight. These brief neurological changes may reflect nighttime mini-strokes, and they deserve immediate attention. The challenge isn't that these symptoms are invisible. The challenge is that they are familiar, ordinary, easy to brush aside. But when we look closely, each one is a powerful clue. In the next part, we'll talk about the everyday habits and assumptions that cause so many seniors to overlook these warning signs without realizing the risk they're carrying. Stroke triggers seniors commonly ignore. As we continue this journey, I want to bring your attention to something I've witnessed over and over again in my years as a physician. The most dangerous stroke triggers are not always dramatic medical events. They are the small, familiar habits and sensations that blend into everyday life so quietly that people stop noticing them. These subtle patterns can be easy to dismiss, especially after 60, when many believe that changes in sleep or energy are simply part of getting older. But sometimes, what feels normal is actually the body waving a small red flag. Take loud snoring, for example. Many couples laugh about snoring or blame it on a long day or sleeping in the wrong position. But when snoring is accompanied by choking sounds or long moments of silence, the body is fighting to breathe. The brain is waiting for oxygen. The heart is working overtime. And yet countless seniors shrug it off because they have snored for as long as they can remember. Familiarity can be deceptive. Just because something has happened for years does not mean it is harmless. Morning dizziness is another symptom that disappears into routine life. People often tell me it happens because they stood up too quickly or didn't eat enough the day before. But that sensation of disorientation can be the result of unstable nighttime blood pressure or low oxygen levels during sleep. When the brain doesn't receive consistent oxygen, even for short periods, it can respond with lightheadedness upon waking. It fades fast, so people ignore it. But it's a message worth listening to. Memory lapses fall into this same pattern. Forgetting a word, misplacing glasses, losing track of a task. These moments are common with age, but that doesn't mean they are insignificant. When sleep is disrupted night after night, the brain doesn't get the chance to detoxify and reorganize information. Cognitive fog becomes more frequent. Some seniors assume these changes are inevitable, but I've seen memory improve significantly once sleep stabilizes. The brain is designed to heal, but it needs the right environment. Another overlooked trigger is the unmonitored use of sleep medications. Many older adults rely on over-the-counter pills to get through the night. The problem is that some of these medications affect breathing depth, suppress the natural sleep cycle, or mask underlying problems like sleep apnea. Without guidance, what feels like a simple solution can quietly increase stroke risk. I've had patients who took sleep aids for years without realizing that their bodies were trying to communicate something more serious. Even sleep duration can send misunderstood signals. Sleeping too little obviously puts stress on the body, but what surprises many seniors is that oversleeping can also be a warning. Excessive sleep can reflect poor nighttime oxygenation, heart strain, or the early stages of neurological imbalance. When someone sleeps 9 or 10 hours, yet wakes feeling exhausted, it's not a sign of good rest. It's a sign the body is struggling. What ties all of these triggers together is the way they blend into the background of daily life. People don't ignore them out of neglect or carelessness. They ignore them because they seem ordinary, familiar, non-threatening. I often tell my patients that the body is a storyteller. It communicates slowly at first, gently nudging you with small changes. But if those whispers go unheard, the messages become louder. The truth is that stroke rarely strikes without warning. The warnings are almost always there, hidden in the rhythm of your nights, the quality of your mornings, and the small changes in your thinking or energy. Recognizing these patterns is not about fear. It's about empowerment. When you learn to see what your body is telling you, you gain the power to respond, adjust, and protect your future. In the next part, I'll share real stories from patients I've worked with over the years. Their experiences reveal how small symptoms can lead to big consequences, and how awareness and small changes can completely transform a person's health and independence. Real-life examples. When I think about how sleep problems quietly shape stroke risk, I don't just think about science or data. I think about the people I've cared for. Real faces, real families, real stories that taught me how deeply sleep connects to the heart and brain. These stories remind me that stroke prevention isn't just medical, it's personal. One of the first stories that comes to mind is Margaret. She was 73, gentle, soft-spoken, and always tried to appear strong for her family. She often mentioned feeling tired during the day, but she brushed it off as slowing down with age. What she didn't mention at first was that she woke up almost every morning with a pounding headache. She'd take a pain reliever, drink her coffee, and move on. Headaches had become so normal for her that she didn't think they mattered. Her daughter finally brought her in after noticing that Margaret seemed confused getting out of bed one morning. She couldn't remember what day it was. By the time she arrived at my office, she felt perfectly normal again. We ran tests, and a scan revealed she had experienced a small silent stroke. Further evaluation showed sleep apnea that had gone untreated for years. Every night, her oxygen levels dipped, her blood pressure spiked, and her brain paid the price. When we addressed the apnea, Her headaches faded, her energy returned, and most importantly, her stroke risk dropped significantly. She once told me, "I wish I had listened to my mornings sooner." Then there was Leonard, a retired engineer who prided himself on being logical and independent. He had frequent nighttime urination and assumed it was just a bladder issue. In reality, it was his heart signaling distress. His body shifted fluid at night because his heart couldn't pump efficiently. Every bathroom trip pulled him out of deep sleep and kept his blood pressure unstable. One winter morning, he woke up with slight numbness in his left hand. He ignored it, thinking he slept on it wrong. But later that day, the numbness returned. Tests confirmed a mild stroke, and a heart ultrasound showed early heart failure he never knew he had. He later told me, "I thought my nights were just annoying. I never knew they were warning me." I also remember Clara, a vibrant woman in her late 60s who had restless legs so severe she sometimes slept only 2 hours a night. She thought it was just nerves. Her brain was constantly pulled out of deep sleep, leaving her foggy and forgetful. She feared she was developing early dementia, but once her sleep disorder was treated and her legs finally calmed, something incredible happened. Her memory sharpened, her focus returned, and her sense of hope came back. She cried the day she realized she didn't need to fear losing her independence. She simply needed restful sleep. And then there is Thomas, who experienced sudden awakenings with confusion, but blamed them on strange dreams. One morning, he woke up not recognizing his own kitchen for several seconds. That brief disorientation was actually a mini-stroke. By the time I saw him, he had experienced several of these episodes. We addressed his sleep apnea, monitored his nighttime blood pressure, and adjusted his heart medications. He once said, "I didn't know my nights were stealing pieces of my days." These stories are powerful because they reveal the same truth. Sleep problems are never just sleep problems. They're windows into the health of the heart and brain. They're messages, quiet, subtle, easily dismissed, but deeply meaningful. What gives me hope is that every one of these patients improved once the root cause was recognized. Their futures changed because they paid attention to the signs their bodies had been sending for years. In the next part, I'll walk you through simple, practical steps you can take every day to protect your sleep, your heart, and your long-term independence. These habits don't have to be overwhelming. They're small choices, gently applied, that make a world of difference. Action steps seniors can use daily. After hearing these stories, you may be wondering what you can do in your own life to protect your sleep, your heart, and your long-term independence. The good news is that prevention doesn't come from dramatic overhauls. It comes from small, steady habits that support your body's natural healing systems. I've watched countless seniors transform their health with simple adjustments, actions that are gentle, manageable, and rooted in self-respect. And I want to guide you through the same path. Let's start with something incredibly simple but surprisingly powerful: the way you position your body at night. Many people sleep on their backs because it feels natural, but for older adults, especially those who snore or have breathing issues, this position can narrow the airway and reduce oxygen flow. Sleeping on your side, especially with a supportive pillow to keep your neck aligned, can dramatically improve airflow. Some seniors even benefit from raising the head of the bed slightly. This small angle can ease nighttime breathing and reduce pressure on the heart, helping the body enter deeper stages of sleep. Nutrition is another quiet but essential part of this equation. Your heart and brain depend on minerals like magnesium to stabilize nerve signals and support muscle relaxation. Leafy greens, almonds, pumpkin seeds, bananas, and whole grains can naturally boost magnesium levels. Many of my patients report deeper, more restorative sleep after just a few weeks of making these foods a regular part of their diet. And while supplements can help, I always encourage checking with a healthcare provider first. The goal isn't to take more pills, it's to nourish your body thoughtfully. Before bed, I recommend a simple breathing practice that has helped thousands of seniors calm their nervous system. Inhale gently through your nose for 4 seconds, hold the breath for 2, then exhale slowly for 6. This technique signals your body to release tension and lowers nighttime cortisol, the stress hormone that can thicken your blood and disrupt your heart rhythm. 5 minutes of this breathing can shift your entire internal landscape, guiding you toward deeper rest. Another powerful tool is awareness. I often encourage patients to keep a small sleep journal, not a complicated one, just a simple notebook by the bed. Each morning, write down whether you woke up during the night, experienced gasping, had a morning headache, felt confusion, or noticed unusual dreams. Sometimes all it takes is seeing a week's worth of patterns on paper to realize something important is happening. Awareness is the first step toward meaningful change. Knowing when to seek help is equally crucial. If you experience symptoms like sudden nighttime confusion, gasping for air, waking with numbness or weakness, or overwhelming daytime sleepiness, don't wait. These are messages that deserve attention. Today's sleep studies are far easier than in the past. Many can be done right at home while you sleep in your own bed. The information they provide is invaluable and can change the direction of your health. Lifestyle adjustments also play a major role. A calming evening routine can lower stress hormones and stabilize your heart rate before bedtime. Dimming lights, turning off screens an hour before bed, or enjoying a warm bath creates a sense of safety and relaxation. Timing your hydration can also help. Drink water steadily throughout the day, but reduce intake after dinner to avoid nighttime bathroom trips that interrupt deep sleep. Even gentle movement after dinner can support your sleep and heart health. A slow 10-minute walk helps digestion, lowers blood pressure, and signals your brain that the day is winding down. It's not about exercise intensity, it's about supporting your body's natural rhythms. And finally, creating a safe, comfortable sleep environment is one of the most loving things you can do for yourself. Keep pathways clear, add soft lighting for nighttime trips to the bathroom, and choose bedding that keeps your body at a comfortable temperature. When your environment supports you, your body enters deep sleep more easily. What I want you to remember is this: healthy aging is not about perfection. It's about small, compassionate choices that honor the years your body has carried you. Every adjustment you make, every healthier night of sleep, gives your heart and brain the strength they need to protect your future. In the next part, we'll bring everything together in a heartfelt closing, reflecting on the strength, resilience, and wisdom your body holds, and how you can move forward with confidence and hope. As we come to the end of this journey together, I want you to pause and think about something simple yet powerful. Your body has carried you through decades of living. It has walked you through joy, heartbreak, long nights, early mornings, and every challenge in between. It has done its best for you day after day, and it deserves your care, your awareness, and your gratitude. Sleep problems are not signs of weakness. They're not failures or flaws. They are messages from your body, gentle reminders that something deep inside needs attention. When we learn to listen to these messages, we gain something incredibly important. We gain power. We gain confidence. We gain independence. Understanding your sleep and your heart gives you the ability to protect your mobility, your memory, and your future. Every small choice you make truly matters. Adjusting your sleeping position, calming your mind before bed, paying attention to morning headaches or unexplained fatigue, creating routines that support your body's natural rhythms. These small steps become long-term protection. They strengthen your blood vessels, clear your mind, and give your heart the support it needs to keep going strong. Recognizing hidden stroke triggers early can change the direction of your life. It can protect your ability to walk, to speak, to think clearly, and to stay connected to the people you love. Prevention isn't dramatic. It's steady, thoughtful, and full of hope. And remember, you are not alone. Here at Senior Health Daily, I'm here to walk with you, to guide you with compassion, science, and decades of real experience. I want you to feel supported, informed, and empowered. So listen to your body while you have strength. Take action while your mind is clear. And trust that healthy aging is not only possible, it is achievable with awareness and care. If this conversation has helped you see your health in a new light, I invite you to stay with us. Subscribe to Senior Health Daily so we can keep this journey going, one wise and loving choice at a time.